Welcome to the first episode of the Real GI Doc Show podcast. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist practicing in New York. Today's episode will just be a quick introduction to me, to the podcast, and an idea of what you should expect from the show. So the first thing is, why do we need another GI or gut health related podcast? When I was researching this stuff, I found a lot of existing podcasts out there by other quasi-healthcare professionals. There's podcasts on gut health from naturopaths and chiropractors, and there's a few good ones out there from dietitians, but I didn't see a lot that were from medical doctors. And I figured, since medical doctors have a ton of experience with dealing with GI issues, why don't we educate the public? And I found some out there from doctors that were focused really on other doctors, but not really many that focus on helping the interested layperson understand more about gastrointestinal health. And the ones that I did find out there had a lot of potentially pseudoscientific information on them. So I figured there's always room for more. But the more logical part of my brain said, if nobody's doing this, that is, if no medical doctors are doing this, then is it a bad idea? Is it a crazy idea? If it was a really good idea, wouldn't other doctors have thought of it already? But then I thought back to the way that I think and my experiences in life, and figured that this whole medical thing in general has been a crazy idea. From the start of it, back in high school, I said I wanted to be a doctor, and I come from a family where the only doctor I knew was my pediatrician that I saw every year for a checkup. He was a nice guy, but I didn't have a doctor in the family to help me out and figure out what this career is all about. So I declared to the world that I wanted to be a doctor when I was in high school, or junior high school probably, or who knows when. But I started reading medical books and textbooks and anatomy books, and everything like that fascinated me. And I figured, well, if other people can do it, then I probably could do it also. I like this stuff. So when I went to college, I signed up for pre-med, and I signed up for biology, like many pre-meds. And I found that I got a lot of naysayers along the way. A lot of people said that you can't do this since you're not, you don't have any scientific background, or you don't have anyone in your family that's a doctor. What do you know about this, Gandolfo? But organic chemistry, people said, was going to be impossible. No one can do it. There's the 50% fail rate, and the other half of the people leave on their own because it's too scary. But I actually enjoyed it. I found that when people tell me I can't do something, it makes me want to do it more. So I did my pre-med stuff and applied to medical school after you take the MCAT exam, which is a fun time. And the way that works is it's like rolling admission. So you interview somewhere, and then they tell you if you're in or if they want you pretty much in a couple of days. And back in the day, I received this information through like a next day air document that would come. And it was not like an email or something like you get today. So I got my acceptance to Stony Brook, which is here on Long Island, and I had a great feeling when I went to see the place. I had a good interview, and I accepted the offer to be in the class of 2006. And it was the first time that it was really a real thing. Like, this is really happening now. Like, you're in, and as long as you stick with it and do well and study, you'll be a doctor. When I got to medical school, there was so much to know. It was mind-boggling. There were the expectation was that you would have to know everything in the textbook and things that weren't in the textbook. Forget about the information being presented in a lecture. Maybe 20% of the information that you needed to know was presented in the lecture, and the rest of it you had to figure it out. You had to read the book, you had to read other books, you had to listen to the lecture again and again. Everything was recorded. It was an overwhelming amount of information. People say it's like trying to drink from a fire hose, and that's really the truth of it. And as long as you're enthusiastic, it's okay. But at some point, you notice that it's working, and you're taking these tests, and you're passing them, you're putting the work in, And you eventually get thrown in your third year of medical school into like a healthcare team. And now you're part of a team. Even though you're a medical student, you're rounding, you're seeing patients, you're learning how to take histories, you're starting to do minor procedures like you're drawing blood and maybe you're doing a little suturing of wounds. And in your fourth year of medical school, because it's a 4-year training, you basically are on the healthcare team. You're helping out. You're acting as like a junior intern practically. You're seeing patients, you're taking histories, you're putting in orders, you're helping out with surgeries, you're delivering babies sometimes. You go from a college student basically when you start medical school to like junior intern at the end of it, and it's a pretty amazing experience. And the training works, so it wasn't that crazy at all. But then you look for residency programs, and that's when you really start your training. It sounds ridiculous. You've already been training for years now, but that's when you actually start your real healthcare training, which is in residency. And residency actually is what matters the most when you think about a doctor's training. When people ask me, where did you go to medical school? And I tell them Stony Brook, that's like a less important part of the training, which I don't think people realize that. Everyone kind of learns the same standardized curriculum in terms of medical school. And it's really the residency training that is where you learn most of medicine. That's when you are an actual doctor. You're an MD at that point, or a DO if you graduated from a DO program. But you're an actually practicing doctor, even though you're in a supervised program. And you're seeing patients on your own, and you're learning a lot on your own, and a lot with mentorship. But you're in there working 80-hour work weeks, seeing patients the whole time. And if you add that up, what an 80-hour work week is for 3 years, which is what internal medicine training is, it's 3,800 hours of patient care per year. And you're also doing lots of reading on your own, and you're thinking about medicine all the time because it's kind of like you're immersed in it completely. So if you're doing 3,800 hours in a year, that's about 11,500 hours in 3 years of patient care and medicine. And that's a lot of experience. And now we're just talking, I'm still in residency, which, a doctor graduates residency, and that's the amount of time they've put into the field already. And there's that old saying that it takes 10,000 hours, or it's usually 10,000 mistakes to really master something. But then people say, it's 10,000 hours. But definitely in residency, you do both. You get those 10,000 hours, and you definitely make those 10,000 mistakes. And hopefully you have enough oversight in your training program that those mistakes don't become big problems. But you get to really go from like a junior intern, medical student type person to a functioning physician at the end of your residency program if you went to a good residency. And that's kind of the training, except if you want to be a specialist, then you have to do more. You have to go to what's called fellowship. So if you're a cardiologist or a pulmonologist or a gastroenterologist like myself, you have to do more training. How's another 3 years sound? Of the same type of thing, another 80 hours of work a week, roughly, a little bit less intense, physically, but just as much reading and other stuff that you have to do in fellowship if you want to specialize. So I remained at NYU for my fellowship in gastroenterology, and about a third of the time that you're there, you're doing procedures, you're doing endoscopy, you're doing colonoscopy, and the rest of the time you're seeing consults, doing clinic and reading and journals, etc. So after doing all that training, it's time to get a job. After you graduate from fellowship, it's time to look for a real job. And a real job means you join a hospital, or you go into academics, or you join a private practice. And I chose to join a private practice after my fellowship was done. So now I'm 31 years old. I graduated from fellowship at NYU, and it was pretty easy to find a job because people want to employ new doctors. Now, think at this time, many of my friends have already been working in non-medical fields for close to 10 years. So they already have quite a head start on their career. But here you are starting your first job, your first real job at 31 years old. And what you learn from your first real job is a lot about how to be a real doctor, because what they teach you in residency and fellowship is great, but until you go out there and practice it on your own, it's really not enough to be kind of like a full practicing doctor. So the way I practice now is definitely different than the way I practiced the first day out of fellowship. And it just takes time, like any other job, to really get better at it. You have to learn how to talk to people, how to take a history, how to make things work in the real world. You're not in a hospital system anymore. So it's a big learning curve. And you also learn in your first real job what you don't want. You learn about how not to practice. You see things happening that don't make you super happy, and you learn what you don't want out of your career. And the shame about everyone's early career is that you don't know what you don't want until you're there. And then once you're there, you're there. And you have to figure out if you want to stay there or if you want to leave. And that's the reason why lots of young physicians end up leaving their first job after a few years, because it wasn't really a good fit for them. Maybe they didn't really want what they thought they wanted when they came out of fellowship, but that's okay, because you definitely take home a lot of knowledge from your first job. And I thought I got into like blogging and about medical stuff. In 2015, I started a blog that probably had 11 people following it, called Retroflections. But it was a cool way to start experimenting with writing and creating something on my own. And that thing still exists out there online, and it gets a lot of views still on Google, but I haven't updated it in years, because the craziest thing was yet to come, and that was starting a solo practice. After I left my first job, that was eventually became an employed job by a hospital. I eventually left that job and went solo as a private gastroenterologist, which, again, the naysayers came out of the woodwork and said, this cannot be done. No one does this anymore. It's a crazy idea. Who's going to make money? How are you going to feed your kids? It's impossible to survive outside of a system. And we opened up in May 2018 in Huntington in Long Island, New York. We survived the pandemic. We grew the practice and moved to a larger building in December of 2021, and I ultimately ended up building out an endoscopy suite, which has been open now for 2.5 years in the new building, and we celebrated our 6th year in business this month. This year, we are proud to be awarded the best gastroenterology practice on Long Island, which was a pretty cool thing to have happen. And over the years practicing, I've now treated more than 10,000 individual patients with GI issues, ranging from simple, common ailments that everyone's heard of to rare, life-threatening diseases, and pretty much everything in between. So that is the crazy story. And that brings us back to the present time, the here and now, a culmination of one crazy idea after another, and now the craziest idea yet. I decided to start a podcast. So here's why I had to do it. As a physician, I have a lot of knowledge and experience with my specific field, but most of this knowledge is discussed with patients one-on-one behind closed doors, which is very valuable and great. But why can't we apply that knowledge to other people? There's so many problems in GI that are so common that so many people could benefit from hearing these discussions. And while you're not going to be listening to actual patient discussions here, because that would bring up all kinds of problems, we can apply some of these general principles, and perhaps we can increase awareness and spread some knowledge about some of these common and uncommon issues that we cover here in gastroenterology. And as humans, why do we have to rediscover everything for ourselves? Don't we learn from what happens to others? I mean, we study lots of things. We study airplanes. We don't need to crash a plane. We can study other plane crashes. Just like with healthcare, we don't need to experience horrible outcomes for ourselves to learn from what happens to other people. So here we're going to talk about mistakes, successes, what works with treating patients, what doesn't work. How do we catch something early by listening to the symptoms and getting a good history? How do we prevent common GI illnesses with lifestyle and diet and other things like that? We're going to talk about cautionary tales and near misses, and we're also going to cover some amazing success stories and people who took charge and changed their fate. This kind of stuff happens every day in medicine, but is really not discussed often once the patient leaves the exam room. I think we have to change that. So what is this show going to be about? Primarily, the Real GI Doc Show is here to provide education and awareness about digestive conditions. We're going to cover some common and uncommon GI conditions, diseases, cases for real patient care, disease prevention. We're going to talk about healthy diet. We're going to talk about unhealthy diet. We might even cover some fad diet and fad internet type stuff. We're going to delve into treatments, medications. Basically, when it comes to gastrointestinal health, we're going to cover the whole shebang. Hopefully, you're going to learn some new things here that will make you a healthier person. We'll do question and answer sessions, we'll do interviews, and I'll cover some literature and studies. But who is the Real GI Doc show for? Well, the show's for you. It's for the interested layperson. There's a whole bunch of podcasts out there that are for other doctors or other healthcare professionals. These are like industry podcasts. That's not this one. I'm not talking to other doctors here, although some other doctors may find this interesting or amusing, or maybe even informational. But this is really for you. It's for the average person who wants to take charge of their health and hear about these things and maybe learn from other people's experiences, what it's like to see a doctor and talk about these digestive health problems. There's going to be a running theme here. We're going to be talking about real-world problems, real-world solutions, and we're going to be talking about building healthy habits. We'll talk about diet. We'll talk about lifestyle. We're going to talk about how to treat things without drugs and how to treat things with medication as well. We'll cover the natural solutions whenever possible, but we'll also discuss what to do when the lifestyle and the diet and the natural solutions aren't working. With that being said, here's what the Real GI Doc show is not going to be about. I'm not anchored to some specific fad or diet or wellness trend or some specific treatment. There's no one-size-fits-all solutions on this show. I'm not going to mention, quote, healing your gut or, quote, resetting your gut or whatever other meaningless buzzwords you see out there on the internet. Sure, I'm going to cover the microbiome and I'm going to talk about SIBO at some point, and we'll talk about some of these trendy topics, which are sometimes real and important, but often overdiagnosed and too simplified to really help people. I'm definitely not going to be explaining every problem through the lens of some, quote, holistic gut health guru type person, because it's way more nuanced than that. And anyone who's thinking that they can, quote, fix their gut with some course or some quick fix solution is kind of lying to themselves. There's a lot of nuance to this, and if it took us as physicians 20-something thousand hours of study just to get to the point where we can even practice this in a real person, then what makes you think that it's going to be solved with some quick fix diet solution? GI is a lot more complicated than that. Medicine's a lot more complicated than that. People are a lot more complicated. And these problems are often multifactorial. And this kind of podcast format allows me to go into some detail and talk about these nuances a lot more than a blog post or an Instagram post or a YouTube video does. This show is about real gastroenterology from a real GI doctor that treats real patients with real diseases. That's why it's called the Real GI Doc Show. If this all sounds like your cup of tea, make sure to subscribe to the show and follow us on social media. I go by Real GI Doc on Instagram, Facebook, YouTube, and yes, now even TikTok. Thank you for listening. I will see you on the next episode.